Hello, I'm Dr. Perlstein. I'm a board-certified podiatrist and have treated over 25,000 patients in the last 20 years. And one of the most common things that I see and treat in my office is bunions. And what bunions are painful areas along the side of the big toe joint, as well as the fifth toe joint. And when people wear shoes, it starts to press, give them all sorts of problems like infections or swelling, and they really can't walk very comfortably. And so what people have done, they've brought me their patients, whether it's their family members or a grandparent or either a husband or a wife, to discuss the various treatments that we have. So if the bunion is early and it's mild and it's easy to take care of, what we simply do is make a special insert in the shoe. It's called an orthotic. We can either describe or tell them how to get a special shoe to help them with the problem. But if the problem is a little bit more advanced, we have a wonderful way of treating these particular problems. As opposed to the traditional orthopedic way of taking people in hospitals and putting in pins and screws, which could make all sorts of problems, we do something that's called minimally invasive surgery. That's a much more advanced technique where the person basically has local anesthesia or IV sedation. They don't see or feel anything that's being done. We do the work by making small incisions in the areas that need to be addressed. The areas are straightened out very nicely. We use a fluoroscope to see what we're doing, and then we put in 1 or 2 stitches. The area is bandaged up, and the people usually end up going home in just a few minutes. The next day is a relatively normal day. They can walk and do most activities. They are not laid up in bed or in a hospital bed. And after a while, they have this wonderful result so that they can have a normal pair of shoes. We have a patient that had a bunion before, and this is immediately thereafter. She was very grateful for us. She felt wonderful. She's happy, and we have a great result.
I went to see Dr. Perlstein because I've been dealing with painful bunions for something like 30 years, and I asked somebody who lives in Brooklyn, who do you recommend? And these were her words. She said, everybody in Brooklyn goes to Dr. Perlstein. So even though I live in New Jersey, I went into Brooklyn to see him, and I'm so glad that I did. Not only was he easy to deal with and knew a lot about my situation, but he immediately guided me to the right surgery for my feet.